Welcome to this video on insulinoma, a rare but significant endocrine disorder. In this presentation, we'll explore what insulinoma is, its causes, how it affects the body, and the available treatments. Understanding insulinoma is crucial for both medical professionals and anyone seeking knowledge about this condition. The precise cause of insulinoma is often unknown. However, it's primarily linked to a tumor in the pancreas, specifically within the beta cells, which are responsible for producing insulin. These tumors are usually benign, meaning non-cancerous, but they can still cause significant health problems. In rare instances, insulinomas can be associated with genetic syndromes like multiple endocrine neoplasia type 1, or MEN1. Insulinoma's pathophysiology revolves around the excessive and unregulated secretion of insulin. The tumor releases insulin independent of blood glucose levels. This leads to abnormally low blood sugar, a condition called hypoglycemia. The body tries to compensate by releasing counter-regulatory hormones like glucagon and epinephrine, but these mechanisms are often overwhelmed by the overproduction of insulin. Prolonged or severe hypoglycemia can deprive the brain of glucose, its primary energy source, leading to neurological symptoms. Insulinoma is considered a rare condition. Its exact prevalence is difficult to determine, but estimates suggest it affects approximately 1 to 4 people per million per year. It is most commonly diagnosed in individuals between the ages of 40 and 60, although it can occur in younger and older individuals as well. There doesn't seem to be a significant difference in incidence between men and women. The symptoms of insulinoma are directly related to hypoglycemia. These can vary in severity and presentation. Common symptoms include dizziness, confusion, irritability, sweating, tremors, rapid heartbeat, hunger, blurred vision, and weakness. In severe cases, hypoglycemia can lead to seizures, loss of consciousness, and even coma. Symptoms often worsen with fasting or exercise. Diagnosing insulinoma requires a thorough evaluation. The key is to confirm the presence of inappropriately high insulin levels when blood sugar is low. This is typically achieved through a supervised fasting test, usually lasting up to 72 hours, where blood glucose and insulin levels are monitored. Imaging techniques, such as CT scans, MRI, or endoscopic ultrasound, are then used to locate the tumor in the pancreas. In some cases, selective arterial calcium stimulation with hepatic venous sampling may be needed to pinpoint the tumor's location. Insulinomas are generally classified as either benign or malignant. The vast majority are benign, meaning they are not cancerous and do not spread to other parts of the body. Malignant insulinomas, while rare, can metastasize or spread to other organs. The differentiation is determined by pathological examination after the tumor is removed. The primary treatment for insulinoma is surgical removal of the tumor. This is usually curative for benign tumors. If surgery is not possible or if the tumor is malignant, medications such as diazoxide or octreotide can be used to manage hypoglycemia. Diazoxide inhibits insulin release, while octreotide, a somatostatin analog, can suppress insulin secretion in some individuals. Chemotherapy may also be used in cases of malignant insulinoma that have spread. Currently, there is no known way to directly prevent insulinoma, as the exact causes are often unknown. However, individuals with a family history of MEN1 or other genetic syndromes associated with endocrine tumors should undergo regular screening and genetic counseling. The prognosis for insulinoma is generally excellent when the tumor is benign and can be completely removed surgically. Malignant insulinomas, however, have a less favorable prognosis, depending on the stage of the cancer and its response to treatment. Recent advances include improved imaging techniques for locating small tumors and targeted therapies for malignant insulinomas. Research is ongoing to better understand the genetic and molecular mechanisms underlying insulinoma development, which could lead to new and more effective treatments in the future.